I am Betsy Glosik. I've been on the Patient Advocate Committee at Society for Integrative Oncology since 2016, and I've also had 2 different types of cancer, melanoma and breast cancer. It's pretty incredible that we have in this country over 18 million survivors of cancer, but that poses another issue with long-term survivorship. We have late-term effects, we have long-term side effects, we have people that are metastatic that will never be off treatment. So how do we improve quality of life for these patients? You know, for me, the Society for Integrative Oncology has been remarkable. The energy that this organization has is unlike any other that I've ever seen. Not just because there's so many brilliant people involved, but the engagement between patients, between clinicians, between researchers, it's all there and we are all welcomed. And it's so powerful to be in that space as a patient, as an advocate, to be heard, to know that you are with like-minded individuals and that you can actually make a difference in moving something forward that's so meaningful. I think one of the challenges that we have as patient advocates is to understand that majority of patients don't even know what to ask for. They don't even know that these modalities exist, that they can improve their quality of life, that they can improve treatment, they can help patients stay on treatment, they can keep patients out of the emergency room. You know, these things are really important, and it becomes a broader issue when we talk about health equity. So the education is a huge piece, and it's getting the education into the right communities, getting it to the patients who really need it and are going to benefit from it. So we really need to educate patients on what integrative cancer care is all about and make sure that everybody knows about it, no matter what background you come from, no matter where you live, no matter what hospital system. So I think it's really important for people to understand that these modalities are researched. We know that they're going to work hand in hand with what we're doing with our traditional surgery, chemotherapy, radiation. I would like people to know that, especially clinicians and researchers that don't understand what integrative oncology is, I would like them to know that this organization exists and that it is very powerful and it's just inclusive. You know, they've worked very hard not only to include the patient voice, but to include a global voice and a global cultural voice to how we can improve cancer care. I think that's really powerful. And I think the more clinicians and researchers know about that, the more it's going to help the field grow.